Thank you everyone for tuning in into the Shut Up or Talk Up Wellness Lifestyle Brand Health Talk. Today we have the honor of speaking to Dr. Terrell Smith, founder, physician, and director of clinical development with Spora Health. Dr. Terrell Smith, thank you so much for joining us today. All right, Al.
Thank you for having me.
No problem, no problem. Would you be able to introduce your role in health and wellness to our audience?
Yeah, I'm happy to. At Spora Health, I'm the founding physician and director of clinical operations, as you said before, which focuses on just development and our company overall focuses on cultural centered care, which is a bit of a different take than you tend to see in healthcare these days. And there's a lot of talk about it, but we've been trying to put some of those things to action. And so my background and training is in family medicine, as it says here. And so working in family medicine, you get to see a lot of the cultural aspects of what's behind the human, more so than just their health. And so with that comes a lot of give and push on how to best get somebody the treatment that they need, whether that be if it has something to do with their religion or something to do with their ethnic background, something to do with their diet come into play and things, and help get up just doing exactly what textbooks say.
Right. Yeah. Well, that's awesome. You use the term cultural content, competent. What was the term that you used, just to clarify?
Culturally competent care.
Okay, culturally competent. And so are you saying that the services that Spora Health provides is surrounded with being culturally competent for a specific community, or for women, for men, or for which culture are we referring to, or group?
The end goal, it is to be able to do it for everybody, but that's always, trying to do everything all at once. But yeah, just got to start little by little.
Yeah.
So the foundation started out looking at the Black community, understanding that every provider gets a different level of training. And so we put each of our providers and just employee members through training itself that helps bring cultural competence and understanding things like different types of nonverbal communication and helping to create motivation within your patients, understanding maybe what they've been through.
What is the process of signing up for Spora Health? What does it look like? Where do they go?
Yeah, so that's a good question. You just go on to sporahealth.com, and then we also have an app. It's available in the Apple Play Store and Google Play Store. And it's very interactive. It's very user friendly. And then the website's built like any other of the healthcare, telemed type services, where you go in, you put in basic information. We try not to overwhelm you up front, but enough so that you just let us know kind of what you need an appointment for, and then we can let you get yourself set up. And one of the advantages to setting up your appointment yourself is we also try to give you the ability to kind of pick a provider that may fit you, based on what they look like or what kind of training they have, because some providers focus on different things. Some are focused on women's health, some are focused on mental health. And so it's kind of catered to the user and gives you that chance to find somebody that can, and hopefully, haven't been a patient myself, but be able to find somebody that can relate to you, because that's just for, yeah.
And here on Shut Up and Talk, we like to connect wellness. You mentioned the process of finding a provider that best fits. What are some tips that you can give to potential Spora Health client that wants to sign up to Spora Health?
I think like one of the best examples is if you hear a good review from a family or friend member, like a family member or friend, trust that review. Because I think like one of the best ways you can connect with a provider is have somebody that can actually be real with you. And that way you can ask questions that might not be so comfortable with a provider that you don't connect with. I'll give you an example to make more sense of that. I've been doing this more recently, trying to ask my patients where they are financially, because for a lot of these tests, it's from a doctor's end, it's just typing and clicking and sending the tests, and that's what it says in the textbook. But like taking that extra step to ask that person, hey, would it be better to do this, in a couple months, or do you think you could afford this right now, is something that like I previously thought was something you shouldn't talk about. Like it's just one of those untalked about things. And then I found out like patients love it. They appreciate that understanding, because I've been there, we've all been there, where you don't have money to do something, feel like you got to do it. So just finding that person that you're comfortable with is probably the key, and using any avenue to get there. Like just personal references are probably the best way I've seen success with that.
Yeah, I mean, we came across Spora Health through social media on Instagram. I believe it's Spora Health, Instagram on Spora Health in our feed. And we gravitated to the diversity. We saw that there was care, there was information for not just information that can actually help everyone. Though currently, I see that the target is for a specific group, but you can see the growth. You can see that information can help anyone. You mentioned earlier about the different providers, and you are the founding physician. And some people, they're not familiar with the different layers of different types of providers. One of the conversations that I've had with the provider, who was an endocrinologist, a lot of people are only familiar with the primary care doctor, and they only assume that, okay, I just go get a checkup. So they don't even want to talk mental health with a primary care doctor. Some of them are not even familiar that the endocrinologist is also, every provider has their specialty and serve their purpose. And the reason why we're having this health talk is to educate our audience as well, to let them know, like, yes, you need to go to your primary care doctor, and you should also look into these other specialists too. My question to you is, as a primary care doctor, how comfortable are you with clients talking about mental health with you? And do you often, refer other specialties to your clients?
Yeah, so
Sorry, that was a lot. That was a lot. I'm like a nerd, so I just always have these thoughts. I'm trying to minimize it, but
no, that was a good question too. I think because yes, the short answer is yes. I personally feel comfortable at this point in time with the training that I have in mental health. But I think the bigger point is that I like to know when I do need to go to the specialist, which would be like a psychiatrist or a therapist. And like therapy specifically, I think works very well in addition to seeing your primary care doctor. So while I might be able to write you a prescription for like an antidepressant or something for anxiety, that therapist is actually they're putting in the time with you to look at the root of why you're experiencing those things. And so I think having that overlap and having a primary care doctor and a therapist on the same page works so much better for people, and it's something that I think we're moving towards, especially with all of the telemedicine and telemental health sources that are out there. But yeah, I think always keeping the door open of there's no way I can know everything. That would be, I don't even know if that'd be a good thing, just being honest.
yeah, I
So
agree with what you're saying. Yeah, I
yeah, so
think,
it's good.
yeah, you made a valid point, and now that you said that, you're right. Having a physician and your therapist or whomever, work together, because essentially you want a support system, right? And also going back to when I viewed the Spora Health page, I had a conversation with someone. I said, it seems like Spora Health is also like a health support system. I mean, essentially that's what we want, all providers or health and wellness providers to be, and to aspire to be as well. But I think I've never heard anyone match up the primary care physician with a therapist and establish it as a team. And I think that is a wonderful thing. And I've never thought of it about it that way, but it does make sense, because essentially your primary care physician, everything has to come to that physician. Am I correct? Or is that how it works?
Yeah, usually like the gatekeeper of all your meds.
Yeah, and so, and then your I don't know, maybe that can be considered your health support team or your health
Mhm.
support system, right? And pushing that everything has to come through the primary care doctor as well, surgeries, just clearance for certain insurance. With my little experience with insurance, sometimes you need certain approval, depending on it's so many dynamics. And so it does make sense to, possibly initiate that conversation with your primary care doctor. I know that some people, they don't they don't really talk about mental health
Mhm.
or emotional health with their primary care doctor. I myself in past years, because I just probably felt like my primary care doctor is going to check my primary physical functions. And that's because I was ignorant towards what the capabilities of what my primary care doctor has and what they can do. Can you elaborate on, you know, what the primary care doctor can do, other than what some people may know?
Yeah, so a lot of us get a pretty good amount of training in treating, short-term things like episodes of depression and grief, as well as like I said, like generalized anxiety, but also panic attacks and panic disorder. And so we kind of receive this training not only through medical school, but also residency. And so even for other providers like PAs and NPs, they also receive this training. So when you are in that initial phase where you need some help and you know that you're not able to do it on your own, it's the first step probably is to talk to your primary care provider, because otherwise it's really hard to get in directly with the therapist. And so when you have that appointment with your primary care provider, it might give you some more time where you don't have to suffer kind of on your own, and it just starts that process for getting you help that's probably been long overdue.
Yeah, and maybe that primary care doctor have a group that they can refer you to. So going back into Spora Health, how does that work? If someone wants to come to see you as a primary care doctor, they go to the website, they can see the options, or would you refer them to a therapist, or how does what does how does that work in that process?
Yeah, so one of
They
the
came to see
cool
you directly or a primary care doctor first.
Yeah, so if they saw me first, I would do what was within my means of trying to help that person. And if I felt that therapy was exactly what they needed, then there's two options. One is we can point them in the direction of a good therapist that we're aware of, that other people have had success with. But the second option is we're a new startup. So we have the cool capability of adding therapy as a new portion of our company, which is something that we're working on to try to have that available for our patients, because it just makes it easier, makes it easier for us to make it easy for them to kind of tie all their care together.
So when I was growing up, I would always hear often that men do not like going to the doctor. I have a Caribbean background. My parents are from Kingston, Jamaica. My mom, she's like, when we grew up, when we were younger, she took us to the dentist. She's like, I think because she didn't have that access and care when she grew up. So she was just like, okay, you got to make sure you have health insurance. Like even in high school, I was telling my friends, like, yeah, my mom have life insurance. She told me I need to have health insurance. I was so afraid of being an adult because she was always like, make sure you have health insurance. Oh, go to school because the government gonna give you the insurance and utilize it. Go to your appointment. So I grew up, you know, me and my sisters, we would run a joke and say, wait, we think our moms are hypochondriac, but not really, we were just being funny. But that helped me in my adult life because I'm always in a space where, okay, I need health insurance, right? Or I need to make sure I have my visits. As a woman, and my father, he's more holistic. He is he has a certain practice of lifestyle, and he isn't so trustworthy. He wasn't, so trustworthy of doctors. And there was a time in his life when he had to go see a doctor, and even certain men, growing up, I kind of see a shift now. I kind of feel like there's a shift. I kind of feel like like men are more aware, wanting to be healthy, but I'm just seeing it within my immediate circle. So maybe it's just what I'm seeing. But as a primary care doctor, what is your perspective on in 2022, men going to the doctor? Do you think that it's an increase, it's a rise? Do you think that men are holding their health in more importance?
Yeah, I think in general it has been an improvement. I think the other big piece of it is that mental health is starting to get a different, like we have a different view on it. It's okay to talk about it now, which I think has kind of opened the door for a lot of men specifically to feel like maybe it is okay if the doctor is the one person I bring this stuff up to. And that's only speaking from my personal experience. I've just seen more people come in and be a little bit more comfortable and be more open to at least getting some of the screening stuff done, like colon cancer screening, prostate cancer screening, some things that maybe previously they were not so open to. But the truth behind it is like usually whoever, like a male's partner is usually going to push them in that direction anyway of getting it done. So I don't know if there's just better pushing that's going on, or
All
if
right.
it's because
Or maybe, even, I often tell people that we want to be mindful of what we're intaking, right? So we have to, like, our social media feeds or our surroundings, I tell people, start following healthy things, right? Start following doctors, start following people that's gonna, like, you can control your algorithms up to so much, but the things that you follow and the things that you support, it's going to continue to feed you. So if you're seeing that information, that's going to encourage you to want to go to a doctor and provider, and have those conversations. So I'm excited about men wanting to go to the doctor. I'm excited about it, and even younger men and taking care of their health. Even if you have a partner, male or female, gonna push you towards that. I'm so for that. I'm glad that the society we're slowly moves in that direction. What's your perspective about obesity as a primary care doctor? Because that's one of the topics that I've been trying to tap into. Obesity, I know diabetes, Alzheimer's. Those are the three things that I try to ask one of the providers that I'm speaking with, but I'll mention obesity with you. What's your thoughts on obesity in America today?
Yeah, so that's interesting you ask. I've been thinking about this kind of a lot recently. Happy to talk to you more about it. The I think obesity is interesting because for some reason, healthcare in America sometimes is driven by insurance. And so what insurance decides is a disease or is not a disease is what stands. And so obesity is one of those things that just very, very, very recently became like has been accepted as a disease state, not just as a lifestyle decision. And so it perplexes me that I've always stood behind. I think that obesity, it does have its genetic component. I think some people do try everything they can and still can't lose weight. And so it perplexed me that this has taken this long to kind of catch up. And so I think it's something that we're going to see change a lot in the next 10 or 20 years, because now it can be looked at as a disease, just like you said, like diabetes, something like Alzheimer's, like high blood pressure. And so we can start like targeting things at obesity itself, so we can do more research, create more medicines, more therapy, different ways we can help to reduce obesity, which leads to so many other bad outcomes like high blood pressure, heart disease, and so many different things down the road if you don't respect it, is like the best way I can put it.
Oh wow. Well, I always thought it was a form of a disease. I can't believe that it's, a recent thing to be acknowledged, but there's always things with why and when things are acknowledged at the time that they're acknowledged. But I'm glad that, we're moving forward as a community to acknowledge it in that way. And so as we wrap up, do you have any last primary care physician tips that you want to share or insight And I say that with the disclaimer that we always let our listeners know that, you know, even with social media, you know, this information we share, always go to your primary care doctor, always communicate with your doctor, do your homework to find your doctor and get that information directly, because your specific dynamic may be different. So, but with that being said, any insight that you can share?
Yeah. I challenge all the listeners to go to your primary care provider with a couple questions about your own health and interests. And I say that because as someone who sees it, I think that's one of the most like exciting things is when somebody comes in and has questions for me that we get to kind of go through together. And that's the stuff we enjoy. Like I'm happy to look up a new supplement or something like that because you want to try it. Not necessarily, I don't always have to be the one telling you the things that need done. It's much better when it's collaborative. So challenge everyone to go in with questions. I think it works out.
Yes, and you know, some primary care providers are going to be excited about it, and some are going to say, "Well, now I have to remember what I was taught."
Yeah.
But it's awesome. Thank you so much, Dr. Terrell Smith. Really appreciate your time, you taking the time out to have this conversation with us today. Everyone, be sure to go to, is it www.sporahealth.com? Is that
Yep.
the website? And the Instagram is Spora Health.
Yep. Spora Health.
Definitely. We are, as you guys know, we're having a series of conversation. This is the Shut Up or Talk Up Wellness Lifestyle brand. We're having health talk, and thank you guys for tuning in. Bye.